It is Tuesday, May 26th. And welcome to the COVID-19 Task Force Daily Update. This will be our 87th consecutive update, and today's is a very important one. We'll have Lloyd Phillips, the Commissioner of Public Safety, in here to make some major announcements. And before we do that, though, we'd like to bring on the Executive Director of the Kahnawà Memorial Hospital Centre, Lisa Westaway.
Thank you. So we have a lot of information to provide today, important information. I'm first going to start with some directives that are being implemented that I already spoke about, but it's just a reminder. The first is about the wearing of masks at KMHC building, at the hospital, and at the KSCS building. So effective immediately, what we're requesting is that anybody who does not have COVID-like symptoms, if you don't have symptoms, you should wear a cloth mask when you come into the building. It could also be a face covering like a scarf that should be doubled up, so wrapped around your nose and your mouth, or a cloth mask, and again worn properly, covering your mouth and your nose. Anybody who's under 2 who has trouble breathing, anybody who has a disability and is unable to remove the mask on their own is not required to wear a mask. And those who have COVID-like symptoms, the directive has not changed. For those people who have COVID-like symptoms, who have had the permission to enter the building, will be wearing a procedure mask, and those you will get at the hospital. So should you come into the hospital and you don't have symptoms and you don't have a mask, then don't be surprised that we'll offer a mask to you. We're in the process of looking at having some cloth masks made, but for the time being we'll use the procedure masks. Again, we ask that you have your own mask so that we avoid using the procedure masks that should be kept in our inventory for our healthcare professionals. Also, I wanted to remind you of your ability to drop off summer clothing for residents on May 31st. So again, all clothing will be washed and dried when we receive it before it's given to residents. So clothing only is all that we're going to be accepting. The clothes should be in a well-tied plastic bag. All the tags should be removed, and all of the clothing should be well identified. So again, that's 12 to 2 on Sunday, May 31st, and it's a drive-through at the testing site, and there will be staff there who will be taking the clothes from you directly from the car and bringing it, washing it and bringing it to residents. So thank you for that. For the next thing, we would like to show you a really interesting video. Many of you are wondering what it's like to have COVID-19, and we do have a really brave soul who was willing to talk about her experience, Krissi Delaronde, and so we're going to present the video to you before I continue with updates.
So my name is Krissi Delaronde, and I'm here today to talk about my experience with COVID-19. I contracted the virus mid to late March. I woke up one Saturday morning and I felt a little bit off, and I started to feel something in my throat. It was not so much sore, but I felt like there was a thick coating, and I was having difficulty swallowing. I started to get a very dry cough and a headache. The second I started to feel like, okay, this could be something, I had to isolate myself in my house, and I'm a single mom of 3, and I have a 2-year-old son, so that was really, really difficult, but I wanted to protect them. My 2 older girls had to take care of my son, which was hard enough on its own, because he's 2 years old, he's very active, and how do you explain to a 2-year-old you can't go see mom in that room right there, you know? She's there, but she can't be with you right now. I didn't want them to get sick. I think that was giving me a lot of anxiety. The whole procedure of getting tested at that moment was really just scary. It wasn't fun, the way, you know, you go into a building and you're not in your own community, you're with complete strangers, and this new virus is taken over, and, you know, just thinking you may have it was, you know, really nerve-wracking for me. I received a positive result the very next day, 24 hours later. If anybody knows me, you know that I'm always with my children, so that was the hardest part. Sorry. I was extremely worried that they would get sick and I wouldn't be able to take care of them. So I did whatever I had to do to try to keep them safe. At that time, friends and family were wonderful. They were coming and dropping off care packages and food and everything else like that for my kids. I was in my room for 16 days, isolated and still with symptoms. And when I finally got the okay, I slowly came in. I cleaned top to bottom everywhere in my entire house. I had to test 2 times negative in order to go back to work. So I got my 2 negatives in a row, a week apart. So that was a great feeling to know that I had beat that virus. I still have a cough. It's over 2 months later. I still have a cough, especially when I lay down at night. My taste and smell has never returned 100%. I think we don't know how our body's going to react if we do contract it, and we don't know the long-lasting effects it will have on our body. I want people to realize that it is very real. It's scary, you know, and as a single mom, you can't just send your kids to your parents. You can't just send your kids with their dads, you know, because you're potentially risking other people. So you have to stay in your house and you have to go through everything you have to go through alone. You know, my kids were alone for those 16 days, so it was no picnic. It wasn't nice, and you know, I'm glad that I'm through it. I don't want to see any of the community sick. I don't want to see anybody get sick. I don't want to see anybody die. I don't want to see anybody get hospitalized. So I think just keeping our distance and practicing hand hygiene, and just, I know it's hard. It's really hard. I miss everybody. I miss my family. We all live in the same town. I think that's kind of what makes this a little more difficult, that if we were to have an outbreak, you know, all our loved ones live here. So that's the part that's different from everywhere else. Keep the measures, as difficult as that may be, you know. It's getting nicer, the weather, so it's going to be more difficult, but as long as you just keep hand hygiene, keep safe distance, and hopefully this will all be over soon. I want to thank everybody who did help us during our time of need for dropping everything off. I really appreciated it, and it helped us tremendously. And I don't want anyone else to get sick, and thank you for listening to my story. Kahnawà.
Emotional, and I hope that it spoke to each and every one of you. It's not difficult to do such a thing, and Krissi felt, she said why she wanted to speak. It was really important to her to transmit her experience so that people understand how serious this still is now. So Krissi, as you may know, was part of an original outbreak at the hospital that was contained very quickly. However, the impacts on her and on her family members, on community as a whole, are still great, and therefore we still have a very big responsibility, and we will have and continue to have a big responsibility over the next year or so to do our best to take that responsibility of protecting ourselves and protecting those around us. And one thing that's important to remember is that the goal in all of these measures, all of the things that we've put in place over the past 3 months, was never to eliminate the virus from the community. The goal was to slow down its progression. we stated right from the beginning that people would get sick, and the goal was also to protect our most vulnerable, so those who are immunosuppressed, who have chronic conditions, those who are over 60, 70 and over, our elders. That was the goal, and really the positive news about all this is that we really succeeded up till now. We've done a wonderful job. The community response and responsibility has been very positive, and because of that, we find ourselves in a position that we're in today. And the important thing to remember is that we have to continue. So I did see a post the other day on Facebook that said that we're in the most dangerous time of the pandemic ever right now, because people are tired of self-isolating. People are tired of physical distancing. The warm weather is out and we're tired of it, and therefore we're putting it aside and we're convincing ourselves that things are back to normal when they are not. So things are not back to normal, and we will continue to have personal responsibilities towards the collective as we move forward, and we're going to continue to educate you so that you're able to continue to do that. However, moving forward, we have to look at what's happening around us and what's happening in our own community, and we have to balance physical health, mental well-being, our economy. We have to look at rates of assault and addictions and depression. We have to think about possible suicides. So we have many, many different variables that are affecting the community right now as a result of the pandemic, which could lead to serious situations, including death, as a secondary consequence of what we're living right now. And part of what we're doing and what we've spoken about in relation to all of these elements is about moving forward with reopening the economy. Reopening the economy doesn't mean that there is no more virus, and if we were to wait until we have 0 cases and 0 chance of death, then we will have, as I mentioned, chance of death and situations from other secondary effects. So there are many things that the task force looks at in deciding when to reopen, and I'd like to just go over those with you today. Dr. Gauthier was here one Sunday afternoon with me, and we presented these elements to you, and you can always go back to that if you wanted to look at it from Dr. Gauthier, but we're going to go through them again today just so that we can look at from then till now, where are we at? So the first criteria that we're looking at when we try to make a decision about when to start up business would be that COVID-19 transmission is controlled to an R effective of less than 1. So Dr. Gauthier spoke a little bit about where we were at the beginning before we had control measures in place, somewhere around 5 or 6, if my memory is correct, but I could be a little off on that. And the last count that we saw in Quebec, we were at about 1.3. So we're still not under 1, which would be the most ideal. But if we look at Kahnawà, we are under 1. Our effective, if you remember, just to remind you, is the amount of people that we would infect if we were to contract the virus and there were no measures in place. So we're at about 1.3 at the last we checked. In Kahnawà, we're less than 1. Presently, we have 2 active cases in the community, as I'm sure many of you are aware, because you're following the numbers on the Montérégie site. So we pretty much meet that requirement presently. If we look in the community right now, we have many people who are, the businesses are open, and many of our community members are going to those businesses. And so so we feel that we're close to that R effective number being less than 0. And Dr. Gauthier has also agreed, in speaking with her, that should we wait to go lower, the consequences on mental health and well-being could be more dangerous. The second World Health Organization criteria for slowly opening up the economy, is a wide-scale ability for COVID-19 testing, isolation, contact tracing. So basically they would like to see, they're stating that there should be a health system in place in order to detect and isolate and contact trace, so to know exactly who is impacted by possible cases. In Kahnawake, we're actually better than anywhere else in the province, and I just want to mention that Dr. Gauthier will be speaking about that on CTV News at 5 o'clock if you want to see her presentation. She's going to be talking about business reopening in general, but I do think that she may refer to our community because we do have a plan in place, and that plan is working with Montérégie Public Health, but mostly within our own community. We have a local public health team who's going to be working with businesses to ensure that people are self-isolating, that they understand what that means, and that we can identify all of their contacts very quickly so that we can reduce the spread of the virus. So I spoke a little bit about our cases right now, and the reason all of the cases that we've had up till now have not transmitted besides the first outbreak in the hospital, which is when we weren't necessarily as aware of the situation, or we didn't have as much information, but ever since, every single case that we've identified, we've been able to identify where the case comes from and who the contacts were. And in fact, there was very little, if no, transmission from one person to another. And the reason for that is, well, yes, the education that we provided, but mostly because most of you are listening to the directives and you're 2 meters away from people, and you're able to identify that when you have symptoms, you need to stay home. So those are things that are going to be really important as we move forward to continue, and you'll have to really use that knowledge that you have to protect yourself and your loved ones around you. So the third point is that outbreak risks and high vulnerability settings are minimized. Again, I'm going to speak about the fact that we understand where our cases come from. We know that our community members travel to the States and back. We understand the closeness of our community within our families. So having that knowledge and having that understanding allows us to mitigate and put measures in place that provide safety. So we are well, that criteria is well met within our community. The fourth one is that workplace preventative measures are in place. Again, I want to just talk about how Kahnawake excels in this area, where we're working really closely with businesses. Firstly, employees and patrons must evaluate their symptoms before coming into the building. Employees are doing this on will do this on a daily basis. We also have the inspectors who are ensuring that all of the environmental adaptations are in place prior to opening. So each business will have to have a certificate before they can open, and our inspectors will continue to monitor that as we move forward. There is no other place that is doing this. So we've really met this criteria, and we're going to be very strong in this area. And so reopening of business is going to happen in a phased and very controlled approach. The next is that the risk of imported cases are managed. So again, this is mostly with respect to cross-border travel. With the education we've provided, we feel that people understand the risks involved of the cross-border travel. If they are still crossing the border and they're able to, we will maintain the request to self-isolate once you come back here. That is not going to change, and therefore there is control in that area. There also is communication between the border and our peacekeepers should there be any risky situations, and so that's not just for our community, that is happening across Quebec, and it's a control measure that happens to be in place. The last criteria is that communities are fully engaged. So this is something, again, that we want to reiterate how proud we are of the community for their constant dedication and maintaining of the directives that we've established. We know that it's been more and more difficult over the last little while, but overall there's been an overwhelmingly positive response, and people are working hard to take responsibility and understand what their role is within the bigger community, and that is something that that shows us that this criteria is also met. So those are the main criteria that the WHO have established as important for the ability to reopen your economy. And when we balance that against, again, as I mentioned, physical health, mental well-being, economy, we see that all of those areas, we see that it's an opportune time to start to move forward. One thing that we wanted to show you also, because it's important, is the number, a table that demonstrates the number of deaths over time. So we're just going to pull up a table. So what we want to focus on a little bit, what I want to show you today is the progression of the number of deaths per week. Well, it's actually a snapshot of 2 days over a 5-week period. And we're looking at Montreal, Laval, Montérégie, and Kahnawà. And what you can see, so the blue line is Montreal, and so the first date that we looked at is April 26th, 27th, where we had 56 deaths. And that number increased April 29th and 30th, where we have 99 deaths. May 4th, 5th, 74. May 9th and 10th, 56. May 23rd, 24th, 20. So we can see that over the past 3 weeks, we are progressively and systematically declining the number of deaths. And it's important to note for all of these deaths that there's over 70% of the cases of death happened in long-term care facilities and not in the general population. Of course, I'm not in any way minimizing the number of deaths, but I do want to show that that things are decreasing in all of the communities surrounding us. So if we look at Laval, Laval is actually a case that, a city that is having difficulty and is on an incline presently. And if we just look from May 9th and 10th to May 23rd, 24th, Laval is the orange line, you'll see that there's an increase in number of deaths from 18 to 45. And that's just, again, a snapshot of 2 days. Montérégie area, so that's Châteauguay, Saint-Remy, Saint-Isidore, Mercier, and it's a wide territory. I don't have all the cities here, but it really does, it's very close to us. That's the green line, and if you look, the number of deaths has been decreased since May 4th and 5th, and is quite low. So again, if we're looking at the number of deaths, an opportune time to open based on number of deaths, it's the medical professionals say that it should be under 10, and so Montreal is still a little bit higher than that, and Montérégie is under 10, and of course Kahnawà, we don't have any deaths, and we'd like to keep it that way. And so in order to keep it that way, there are some things that that are going to be expected of each individual in order to contribute to the collective. So again, moving forward with reopening of business does not mean that there is no risk involved. So for the next year or a year and a half, I can't really say, until there's a vaccine, everything that we do will have some element of risk to it. And so the important thing that we have to remember is that we have a responsibility to evaluate what we want to do and evaluate the level of risk that it may pose to ourselves, to our family, to our community, and make modifications to how we may do that. So the gatherings of up to 8 people, for example, you can do that safely, or you can do that with a lot of risk and with a high probability of transmission of virus. And so again, it's about the knowledge, using the knowledge you have in a way that ensures the safety of all of those around you. So part of what we are doing to try to assist is we created a pamphlet. It's not quite finished. It will be finished by the end of the week, and we're going to put these in all of your PO boxes and all your mailboxes. And basically it says, how can I protect myself, my family, and my community? And inside we have a lot of different elements that we've spoken about, but our goal is to reach out to as many people as possible. We really want everybody to fully understand their responsibility as we move forward about social distancing, about hand hygiene, about respiratory hygiene, about non-medical masks, and basically about how do we protect each other. So all of this will be in a pamphlet that we're going to provide to you, and you should have it by the end of the week or early next week. So speaking about that, I wanted to just cover one, speaking about the possibility of return to work and reopening the economy. We have had a lot of questions about our vulnerable population, so those with chronic conditions, those who are over 60. So we also prepared a table for you that is going to be on the website in the For Business section of the KMHC website. And on this table, we're trying to give you as a person who may be going back to work, or your employers, a little bit of a summary of how you might want to evaluate your case and speak with your employer about this. So basically, I'll go through it quickly. Vulnerable workers who are over 60 years old. So just a note, over 70 are at the highest risk for COVID-19 complications, including death. Over 60 are also among the most severely affected, and over 97% of COVID-19 related deaths have occurred in over 60-year-olds. So this is a snapshot of the medical advice regarding return to work. So we are also in the process of translating 2 documents from the INSPQ, so that, remember, that's the research arm of public health, and those will be attached to this document. And we would like to refer employers to those documents for more specific details. And as an employee, if you have any concerns about your health, we really urge you to contact your physician. So if you're over 60, immunosuppressed, or you have uncontrolled or complicated chronic disease, if you are obese or pregnant, if you can answer yes to any of those questions, then there should be modifications in your work environment. So working from home would be preferred. If you have to work on site, that you have strict adherence to the 6-foot rule. So you make sure that you arrange your work environment so that you are never within 6 feet of another person. You have to make sure that infection control measures are consistently applied. Again, the employee, not everybody who should or could stay home wants to stay home, and that is each employee's right to work if they choose to do so. But it's really important that if you do choose to do so, that you're informed by your employer of the risks, and you should expect to be informed and have that discussion with your employer to make sure that everything is done to mitigate the risks in your workplace. And if your employer or you are not able to adhere to the measures that should be implemented, then you should be off of work. So we're providing that information to you, again, as an individual who may be thinking about going back to work, for employers, so that they can work through those risks with their employees also. So just to continue on a little bit about reopening business, I'm going to pass the discussion over to Lloyd, and he'll give some more information and details. So thank you.
Thank you, Lisa. Very informative piece of information. I know that we have a lot of information today, but I think it's really important that we provide the information to show the community where we're at, and to also show some of the work that happens on a day-to-day basis, behind the scenes here at the task force and also over at Kahnawà Memorial Hospital Center. So with all that information that Lisa just provided you, and including the criteria established by the World Health Organization and what is required to reopen, along with certainly the advice from our medical advisor, Dr. Kahnawa'kehró, I'm here today to formally say that the date for reopening of the Kahnawake economy will be June 1st. That date has always been tentative, but today I'm here to confirm that that will be the date for phase 1 of businesses to reopen within the Kahnawake territory. This business reopening is going to be done in a safe manner. It's going to be done with measures, as Lisa mentioned, that are not done anywhere else in any area in Quebec, certainly, maybe across Canada, where we're going to have every business will require an inspection and get a health certificate to ensure that they are meeting the proper health and safety standards to ensure the protection of the employer, employee, and as well as the clients, and obviously overarching the whole community as a whole. So that's something that we're going to ensure that it's actually in the process of happening, and it's going to continue over the next week to ensure that we cover all the businesses who are allocated in phase 1 are prepared to open. And I hope that for the community members who have raised some concerns about the reopening of businesses, that knowing that there's going to be strict measures in place, there's going to be ongoing inspections, there are going to be strict criteria for them to follow, I hope that helps alleviate some of your concerns. No, because at this point there is no scientific reason for us to say let's remain closed past June 1st. As we said from day one, when making decisions, on behalf of the community, by the task force, we always said that science will lead the way. We're not gonna move based upon economic pressures and things of that nature. We're gonna look at it from a scientific perspective, and at this point in time, all the scientific evidence is giving the green light to move forward. So that's what was the final determination for us to say we are taking these next steps to address the many concerns of our community. Again, everybody and many people they want to get back to work. They're having a hard time at home. They want to see that paycheck coming in again every week. Obviously, the people who own the businesses are having a very tough time. Everybody has overhead and bills they want to pay, so people certainly want to get that taken care of as quickly as possible. But also, again, the whole mental health aspect. People have been in virtual lockdown for many months or many weeks now, and by them having a sense of normalcy coming back into their life, into the new normal, as we've been saying, that will help alleviate, I guess, some of that anxiety from a financial perspective, but also from a perspective of mental health, and moving forward. Like I said, I know that creates a little bit of fear in individuals, both on all levels, from community to employees to employers. But with the information that's provided, with the proper safety mechanisms in place, and people abiding by it, the risk of transmission remains very low. So we obviously we're looking towards all the people involved to ensure that our community remains safe and that diligence is taken into consideration. No, obviously, again, along the lines of fears, and people are concerned that there'll be a lot of people coming from the outside into the community, having the possibility of more spread. Again, that was one of those things I talked about a little bit the other day about about actual increase in possible transmission of the virus versus what maybe could be perceived as a threat. And again, talking about all the evidence that's out there in terms of medically, as long as the measures are followed and taken seriously, again, by having additional people in the community, the risk of transmission is very, very minimal. all dependent upon the responsibility of the employer, and the community as a whole. So we put that in place to ensure that again, those fears of community are addressed, and looking at it again purely from the scientific point of view, and I was very clear in saying, if we do this, is there a risk to our community? No, and the short answer is no. If people abide by the proper regulations, no, the risk is extremely low. So that gave me some reassurance. Also, there was concerns, raised about having additional people, in and around the community, coming here for no reason. That was a concern that was raised. Dwayne Zachary will be here in the next couple of days to talk in more detail on what they're going to be doing. But basically, what we have a much heightened vigilance in the community to ensure that anybody coming here is coming here for a valid purpose. We don't want to have people come into the community just to hang out, so to speak. If you're coming here for commerce, you're coming here for a valid reason, fine, you're welcome to be here. But after you're finished your business here, you're going to be asked to leave. And if people don't want to abide by that, again, that's part of the heightened vigilance that the peacekeepers are going to be doing, and they will deal with those people accordingly. Along the same lines, we also going to be ensuring that there's clear signage and additional directives that are out there, aimed mainly towards the outside, but also for our community members to understand that the recreational areas in our community are for residents only. And we're going to be putting up signage along those the bike path, for example, the bike path areas along our community. We have a great set of bike paths here, so we're going to be putting up signage there to ensure people understand that despite businesses being open, these areas are for residents only. Areas such as Kahnawà Island, where a lot of people like to go for exercise and go fishing and hang out. Again, those are areas that will have more clear signage that's going to be for residents only. So that's something, again, we want to put that out there more as almost like a package to say that we're looking at the whole community in various ways to ensure that we're addressing the concerns and moving forward in a positive manner, but in a safe manner as we possibly can. Along those lines as well, I know previously we talked about closing down of playgrounds and recreational facilities, splash pad, things of that nature. At this point in time, those will remain closed. Though the evidence is not there yet on ways of properly and safely moving forward with opening up those types of facilities. So that's something that will be assessed over the coming days and coming weeks. And when we feel the time is right, we certainly want to open up those facilities for our community. But again, the science is not there, the proper procedures are not there. So at this point in time, those will remain closed as well. Just again, for clarity for you, may not recall, when we're talking about the business reopening, the way we wanted to do it is to make it as fair as possible for most businesses in the community. Whereas you may have seen in other jurisdictions, they only opened a few businesses 1 week, they waited another week, they opened a few more, and then they waited another week, open a few more. Again, and that caused some problems with business owners, because it seemed like it was unfair advantage for certain businesses. So what we decided to do internally was make it as easy as possible, and get most of the businesses in the community to that starting line, so to speak, at the same time. And rather than focusing strictly on phasing in businesses, the focus is certainly on mitigation of risk and proper safety standards. And as long as those proper safety standards, again, are in place and businesses have all the proper information and everything is properly inspected, having more businesses open at the same time, gives that fair advantage to everybody, but at the same time, protecting the health and safety of our community. But what's not included at this point in time is because of the inability for social distancing, which is still a key cornerstone in what we have to do. and also high contact areas where you have equipment or glasses or stuff like that, where there's a high contact, high interaction with individuals, where you can't social distance, and you have the possibility of spreading the virus around if somebody happens to be infected. So that includes bars and social clubs, any gaming establishments, restaurants with sit-down services, hair and beauty salons, and gyms. Those are the areas that, over the next couple of weeks, we may start phasing in various businesses as we go along, and as the measures evolve, as regulations evolve, what safety mechanisms need to be put into place are adopted, and then these businesses, over an extended period of time, could open their doors and safely and as much as humanly possible. And this is what we're saying. We're opening, to the new norm. That's the phrase that we've been coining that phrase, but you watch any other media, that is the new normal in which we're going to find ourselves in for the next year plus, because this virus it's here. We managed it great as a community. All the numbers and everything that we're doing shows that we are ready to progress. We're ready to take that next step, the next evolution, and we are here now. I understand clearly that there are concerns and some fears of community members, and believe me, we heard them. The task force shares those concerns, but we also feel that by taking the measures, they're properly mitigated, they're properly addressed. We had multiple discussions, many different angles, many different viewpoints on what's the best way forward. But putting everything together, at this point in time, is the best way for our community, for the individuals' mental health, for the economy, and also to ensure that we minimize the possible spread of the COVID virus within our community. So there's a lot of information that we put here together, and today we want to lay it out in a clear manner as we possibly can. Certainly tomorrow and the following days, there'll be more detailed information coming on Facebook Live and other areas. We'll be distributing information. Ongoing inspections. If you are a business owner and you didn't have an inspection yet, you can contact the public safety department, the task force, or you have inspectors at mck.ca. You can send an email. We have people going out there to do inspections. If you don't have the proper information at this point, you could easily go to Kahnawà Memorial Hospital Center, KMHC.ca site, follow the links, and you can find all the documentation that you need in order to implement the proper safety standards for your business. One other final point that I want to address before I leave, and this is something that we had many calls over the past 2 weeks here at the task force. People inquiring about general delivery services for the community. A lot of people want to order new lawn furniture. They want to get stuff delivered, such as new bedroom sets, living room sets, stuff of that nature. Or do people want to have a tree cutting service? They want to have gardeners, things of that nature. That also will fall in line with the June 1st date. So if you're in need of any of those products that you want delivered to your home, you want any services coming to your home on June 1st, those will also be permitted. So we're opening the gate, so to speak, to allow for things to happen. It's going to be measured. It's going to be evaluated. There will be an additional health check done in the community in the coming weeks. We're looking at people in terms of them being responsible for themselves and for their businesses and moving forward. It's going to be I guess a uneasy time for many. But again, it's important that we take that step and we take it carefully, because the last thing we want to have to do is pull back. We're opening up the gate. Things are allowed to move forward in a structured, methodical way, and we certainly don't want to have to pull that back. Because as we've seen in other jurisdictions around the world where they open up businesses and they start operating and then they had to close them back down again, the economic impact was greater than them staying closed for a longer period of time. But we do feel strongly that we are definitely at that point where we have to take that next step, and that next step is going to be June 1st. I know some of the concerns that I spoke to one individual today, and I'll end off by saying this, that they said some people felt, maybe it's, there's only so much control that they have, and they feel like a sense of anxiety because of businesses opening. And believe me, we all feel that anxiety to various levels. But if you are not comfortable with having businesses open in the community, and that's your prerogative. And some people said, well, I'm still going to stay home. I'm still going to not let anybody in my home. I'm still going to maintain strong measures. I'm not going to allow, as a directive yesterday, I'm not going to allow up to 8 people into my yard or whatever. Again, that's your personal choice, and I support you wholeheartedly. If that's what you want to do as an individual, that's your right, and that's your prerogative. What we're trying to do here is put everything out and have that information and that responsibility for each individual person to pick it up and be responsible and take care of yourself, take care of your family, and ultimately we're taking care of our community. So with that, Kahnawà, I'll see you tomorrow.
Right, Nyawa Lloyd and Nyawa Lisa as well. Ton of information, and finally the date is set. We've been talking about it for a couple of weeks, but Monday, June 1st, open for business. We'd like to also thank Krissi Delaronde for her very heartfelt opening up about her situation as she suffered through COVID-19. And she's a younger person, and the fact that even though she's recovered, she mentions a couple of things that haven't come back yet, her sense of smell, her sense of taste. So even if you're young, there could be effects, and that's why it's so important to maintain all of the careful practices that we've been advocating and that by and large the community has been abiding by. So keep up the good work, everybody. Just a couple of notes before we leave. Lisa mentioned that KMHC and Sigotliet House Community Services now require a mask if you're a client going into those facilities. And also the summer clothing delivery service or delivery that's happening at Kahnawà Memorial Hospital Center will be happening on Sunday, this Sunday. So make sure you follow all the rules. And yeah, it is time for summer, and I know a lot of the residents who are there long term, they change all of their wardrobe for the year, and the families do that. So that's going to happen on Sunday. And I guess that's it for us. There's a lot on this program, a lot on the plate. So we'd like to thank you for joining us. Stay safe and stay clean, stay apart, and if you're sick, stay home. Take care of yourselves. We'll see you next time. Kahnawà.